Sleep apnea is a common disorder best described as pauses in breathing or shallow breaths that interrupt the normal sleeping patterns. This prevents a person from getting the restorative sleep they need. We spoke with Dr. Stuart-Menn at Desert Regional Medical Center in Palm Springs to find out about new methods of diagnosis and treatment for sleep apnea.
Sleep apnea as an adult condition is one in which during the nighttime, when the defenses to the upper airway are relaxed, the muscle tone that keeps the airway open is relaxed, certain people are vulnerable and the base of their tongue, it's generally at that site, falls against the back of the throat, obstructing the airway and making it impossible for the patient to breathe for a period of 10, 20, 30, even up to a minute in length. This is one condition in which the bed partner plays a significant role in getting the history. Now there are some people, it's the minority, that will know that something is going on because they're waking up in the middle of the night with a feeling of suffocation or gasping or gagging. They wake up with a very dry throat, sometimes a painful throat. They're in the minority. Most people with sleep apnea, at least at the beginning, will actually say they're sleeping quite well.
And how is sleep apnea diagnosed?
Well, the standard of diagnosis today is a sleep study. It's called a nocturnal polysomnogram. It's generally done under observation of a technician. We monitor various aspects of people's breathing, their brain waves to know when they're sleeping. There's been more and more of a tendency to see whether there are certain patients that we can also detect this in an ambulatory setting, like in their own home, with equipment that they can pick up and take home.
What are the treatments for sleep apnea?
The severity of the sleep apnea dictates the options of treatment. There are three major options of active treatment. The one that has gotten the most publicity, because it's the one that's been used most effectively over the years, now almost 30 years, since 1982 when it was introduced, is to basically pressurize the upper airway. We call it a pneumatic splint. The term CPAP is often used. We often start that way because we know that it has a very high chance of working. Well over 95% of patients who can tolerate the CPAP will get effective use of it. And also it is non-invasive. The other two treatments are to use an oral device or a dental device. These dental appliances now have been perfected. They're better and better. And basically what they do is they protrude the jaw, the mandible. By pulling the mandible out, you can create a space of that much between the base of the tongue and the back of the throat, and that often can be effective, especially in mild to moderate sleep apnea. And then the third treatment is a variety of surgeries. Surgeries that are aimed at the palate, the uvula, which is that piece of flesh that vibrates and causes most of the snoring, and then even more aggressive surgery in which you actually reconstruct the jaw. There are many other areas that people should consider in the treatment of sleep apnea. For example, control of allergies, the patency of the nose. People who will never snore will admit they do snore when they get a cold. Okay? The use of alcohol or the avoidance of heavy alcohol at night can be helpful. Weight loss can certainly be helpful. Positional sleeping, sleeping off your back, not on your back, but off your back can be helpful. So there are a variety of things I like to go over with the patient and try to see if we can handle the sleep apnea in an easy way before we can get into the more challenging methods.